Patient portal messages, are they the bane of your existence? They were the bane of my existence as a primary care nurse practitioner for a very long time. I have, in the last year, learned a lot about boundaries with them, and I am no longer answering messages at like 11 p.m. while I'm not being paid. And I thought I would impart what I've learned on you so you can also set better boundaries. Okay, so let's start with step one of how did I decrease my patient message burden? I started by explaining to the patients how to actually use the patient portal, because that is not in any way, shape, or form intuitive. One would think, as I would think too, if I was a patient, you're giving me this portal to communicate with my healthcare provider and team. Of course, I'm going to use it to communicate with my healthcare provider and team. So we have to teach them how not to do that, right? And I start by saying, here's what this portal is. I usually do this after when I'm meeting a patient for the first time, and I'm saying, here's how to communicate with me. And this is going to vary based on your preferences, but I tell them what I like to use the portal for. I'll say, we have this portal. I don't truly know why it exists because it's not a great way to communicate, since we can't really work up new problems. We can't really add to old ones because all of that is best and most safely done with an appointment. You deserve your concerns to be addressed at an appointment where you have my full attention. So most things you're gonna have to come in for. And I know that stinks. The portal is useful for med refills. If you want to send me a picture of your kid's rash to see, like, do we need an appointment for this? You could run something by me and be like, should I come in for this? And I'll be like, yeah, or no. Or just giving me updates like, hey, I went to cardiology and they said this. Love that. Love that. Thank you. And then they're gonna be like, well, that's not much. I'll be like, no. And you're gonna decide this for you. What would you like your patients to use the portal for? That's personally what I use it for. I also tell them when they can expect to hear back from me. So I work 3 days a week. I'll say, I check this usually on the days that I am here. Sometimes it's too busy and I simply don't get to it. If it has been longer than 2 weeks, please call the office and see what's up. Maybe I was sick, maybe I was on vacation, and that gives them when they can expect to hear from me and what to do if I don't respond within that time. Now, if your employer requires you to respond within a certain amount of time, at the end, I will tell you how to address that, because I know some of you are in that situation. Don't worry, I got you. And after we have that little spiel, I'll say, do you have any questions? Usually they will be like, this sucks. Like, why is it this way? Again, we're focusing in on them and patient safety. I want to be able to give all of your concerns and questions the time that they deserve. And with the current model that we have with insurance, they simply do not reimburse for me to be chatting with you over messaging. If you want to take that up with your insurance company, that's where we can direct that. And then we might go on a little tangent about how insurance sucks. And I'll be like, yes, I totally agree. At this point, we've laid a beautiful foundation for our patients, right? And you told them how you want them to use the portal, what they can expect from you with the portal. And now we're going into the real world. And the real world doesn't always operate, no matter how beautiful your speech was, by all these rules. And so you do have to have some mental rules in place, because people might flirt with the idea of maybe just seeing how serious you were about some of those rules. Okay, so here's my personal rules for managing my patient portal messages from patients that will guide how I handle my portal. The first rule is newborns. Parents of newborns can ask whatever questions they want, and I will usually respond. And I tell them that. I'm like, for a little while here, I would like to be your resource. This might not work for you. I don't have like an insane number of newborns at all times. So for me, this is manageable. I'm like, please just ask me. If it's urgent, call the office. But if a little question pops up, if you're like, oh my goodness, is this baby acne normal? I'll be like, yes. And I will check my messages once a day and I will respond to you. So newborns, you get a pass. And then I literally tell parents at a certain point, your newborn phase is done. So you might need to actually schedule more appointments. But for newborns, like dragging them to the office for appointments is sometimes simply horrendous. I've had 2 of those. That sucked. So I will answer your questions over portal much more leniently than as they get older. Rule number 2, if your question requires me to ask more than one follow-up question, you must come in. It's not safe for me to tease out all this information from you if it's not a very simple, do I want vitamin D3 instead of vitamin D2? And I'm like, yes or no. If it's more complex than that, there's probably more nuance and it needs an appointment. Rule number 3, if I am worried about them not getting my response back to them in a timely manner, and like that's going to affect things, they need to have an appointment. If this is in any way time sensitive, appointment. Number 4, if my response is going to be more than like 3 sentences, got to make an appointment. That's because this is going to be a more nuanced conversation. They're probably going to have questions about it. Clearly, there was enough to be said that it took like a mini paragraph, which means it probably should be like really officially documented somewhere. And we're going to need an appointment. 5, if this changes the course of treatment, we're going to need to have an appointment and a discussion about that. I don't want to alter your life based on a portal message. That does not sit well with me. 6, I do not order labs based on portal messages. That's a lot of work. You got to go in, see what their last labs were. Is there anything else we need to follow up on? What were we doing? We have to assign it all ICD-10 codes in order to order it so that it's going to get covered by insurance. Send the labs, respond back to them, be like, yes, we did. That's an ordeal. No. We're not ordering labs through the portal. You got to come in and make an appointment so that you are getting the labs that you need. We're not missing any. And then what if you ordered labs and then symptoms changed, or it was something the patient wanted to, like, in addition to that? No. If you need labs, I want you to come in so we can talk about it. We're all in the same place. You're not going to get stabbed twice. And it's respecting my time because that takes a long time. And 7, I will do refill requests via the portal, especially for controlled substances. I live in a state where I can only give 30 days of controlled substances at a time, depending on their class. And that's really annoying for people to have to call every single time if you don't like the phone. So I'm just like, just send me a message. That's totally fine. Give me a week at least, so heads up. But you can send me a message if you need a refill between our med check appointments, and that's fine. And those are my big rules. Do I lay all of those out for my patients from the get-go? No, because that seems a little bit punitive. I don't know if that would be weird. Let me know, I guess, if that would be weird. Would you find that odd if I gave you like a handout and I'm like, this is what you can contact me and this is what you can't contact me about? I can't tell if that would seem odd. So do let me know down below if you would like that, if your healthcare provider gave you a do's and don'ts of how to contact me, more than just like the little speech I gave in the beginning, because maybe it would be helpful. Maybe it would give guidelines. I would personally love that. I'd be like, I need the rules. So those are mine. Yours are going to look different. Find out what sits well with you. And it feels mean. And you have to sit with that and be like, this feels really mean and icky. And it does. And it sucks. But I've done it the other way. I've done it where I answered all the messages. I tried to be really accommodating. I ordered the labs. I worked things up. I adjusted medication doses. And I was basically having a million appointments happening at the same time. And it wasn't safe. It wasn't it wasn't documented in their real chart. So then I didn't know where I was in the world of their chart versus the messaging. And it got messy and it took so much time. And it was not sustainable. Okay. And you might have to sit with that for a minute and really let that soak in, that like, when it's not okay for you to be asked to do unpaid labor. We do not expect like to call our plumber and be like, hey, can you just like work this up for me real quick? I don't want you to come to my house, but I just want to like run it by you and figure out what you would do. We wouldn't do that and expect them to do it without getting paid. We don't do that to lawyers. Send them message, like, right. That's why you have like a retainer and all these, like, they charge a fee for all of that. So why would we think, oh, I can just do that without getting paid, which feels icky, right? Because we didn't go into this most of the time being like, oh, I want to nickel and dime everyone, but you do deserve to be compensated for your time. And you doing it outside of the bounds of work is just your employer taking advantage of you at that point, and your generosity and your connection with your patients is being exploited. Now, if you're kind of like me, that might take a long time to really settle in. The thing that really did it for me was the patient safety aspect of this is not being documented well. This is creating a whole lot of chaos within the chart and everything, and I'm not fully able to work things up. I can't ask them questions like I would if we were having an appointment. This is not providing them the safest level of care. And that is actually what got it to click better in my brain. So pick whichever one you want to convince yourself, but you do not need to be spending all of your time answering patient messages. It's not sustainable. It's not really helping people. And it's just not the vibe. And I think it adds to the moral injury just a little bit of working in healthcare. And that's just that you want to help people, right? Does it totally suck that a lot of people won't be able to afford an appointment or take the time off of work to come into an appointment? So now they're not going to be able to ask you a question. It's another barrier to care. Absolutely. But you doing this and answering the questions anyways isn't solving the root problem of we have such a lack of access to healthcare in this country. You individually going way above and beyond is just going to burn you out and remove you as a caring healthcare provider from the equation. It's not going to solve the underlying problem. This all comes down to, in our country, healthcare is a for-profit business based on people, which is icky and gross, but you aren't going to solve that individually. Okay. We need you to stay not burned out so that you can stay in the game. This is my pep talk to you and me at the same time so that we can keep going. So we've explained to our patients, here's how that's going to go. We have our own mental rules that we've employed, and we've said, these are my boundaries. Now, What happens when people test those boundaries, right? Because people are going to test the boundaries no matter how pretty your speech was in the beginning, and they're going to still ask you for things, right? How do you respond? I'm going to give you some scripts of what you can say. I have a formula for most of these, and that is you thank them for communicating or say something slightly reassuring, and then you tell them, hey, I can't do that. So you're not just saying, I can't talk about this. Scenario 1, the patient messages you and they're giving you a new scenario. Hey, my left foot, it hurts. Or maybe a situation that you've been talking about before, my abdominal pain is now moving to the right side of my abdomen. I'll be like, thank you so much for letting me know. Please schedule an appointment so that we can discuss it and give it the time and attention that it deserves. Scenario number 2, this is when the patient is giving you a complex question. When the answer is going to be more than like 2 sentences, or it's nuanced, or you need to clarify with more questions, anything complicated like that, I say, these are great questions. I want to make sure I can answer them fully and clear up any other questions you may have surrounding this. Please call and schedule an appointment so we can do that. If they are requesting labs or images or something of the sort, I would love to discuss this further with you and make sure we don't need any additional testing or imaging. Also, since it sounds like we'll be ordering tests, we're going to need this documented in an appointment so that insurance is willing to pay for it. So will you please call the office and schedule an appointment so we can discuss further? And the last big scenario I feel like I see is patients wanting to change their medication dose via a portal message. I will say something like, I can definitely help you adjust the dosing of that. However, I would like to see you in the office in order to do it. That way we can really make sure this is the safest option for you. We can go over any additional side effects or medication nuances that this might bring about. And just make sure that those symptoms that you're having and necessitating the change can't be attributed to anything else. Please call and schedule an appointment just so that we can keep you safe and hopefully get you feeling better soon. Now, even if you said it nicely, which I hope that sounded nicely, people are probably half the time still going to be annoyed and mad at you. Usually I found like slightly less so if you had already had the chat with them at the beginning of when you met them of like, hey, here's how I like to use the portal. But still, even when you did the nicest speech, some people are still going to be really annoyed with you that you are not doing these things because, again, a lot of people see it as like, it's just a little question or a little favor because they don't have your job. They don't know all the work that goes into it. So what do I say when people say, oh, no, I can't make an appointment. Can't we just do that over messaging? I typically just give the same general response of like, unfortunately, it will need an appointment to make sure it gets the time and attention that it deserves. If you do have a problem with that, you can always contact the office manager. And why are we bringing the office manager into this? Well, because whether they like it or not, they are the go-between between the patient, you, and the office. They are managing the care of this place, and they are ultimately the ones who are deciding where your time is allocated. They are trying to balance making money and patient satisfaction. And that is the job of the office manager. So let them do their job. Okay. It is your job to set boundaries, stick to them, and provide safe, evidence-based patient care. And it's their job to figure out the other aspect of it. Now, let's say your manager comes to you and they say, I've been getting all these people coming to me and contacting me and saying that you are not responding to messages. You have to respond to these messages. And that is where you can, again, send a boundary. And you are not immediately going to be like, I don't have time for that. Okay. You're not going to go into that. You're going to say, okay, you want me to respond to more messages. I am currently maxed out in terms of what I can produce during my work hours between seeing patients, charting it, and going through all of my inbox. One of those things being my patient messages. I am super maxed out. So I created, boundaries with my patients. Some of them are unhappy with that, it sounds like. So what would you like me to deprioritize so that I can prioritize patient messages? Things I'm not able to budge on at this point are reviewing labs and images because that's a huge patient safety thing, and getting refills done within a couple days of the message because, again, the patient safety thing. So those for me are pretty much non-negotiable. But I could delay my charting a little bit and turn in my charts later for reimbursement and approval. And I could decrease how quickly I get forms turned over. Again, that might make people frustrated, but I could have some slower uptake on those. Which one of those two would you like me to deprioritize? And then if they say, well, I need you to get all of that done, you will say, okay, well, I am already, as I said, maxed out within the time of my working hours. Are you insinuating that I should work at home unpaid. That's not good. That's not good for them to have to say out loud. Okay. That's going to make them be like, hey. And at that point, you leave it in their court. Maybe they'll tell you, yeah, who cares if you get your charge closed? I doubt they'll say that, because that's how they make money. They might be like, okay, I guess deprioritize forms and stuff, which then you could point out that's delaying care. And you will be telling all of the patients that they can communicate their unhappiness about that with you again on that. But sure, that's fine. It's their choice as the office manager where they would like the patient satisfaction to come from. Messages or that, then you can say, how much time a day would you like me to allocate towards patient messaging? I know I get an hour of admin time. Can we meet and discuss how you'd like me to break that down in terms of where you want me to allocate my time? And that really is putting a lot of it back on them to figure out how exactly they're going to solve this pickle that they've put you in. And then the final step to this, maybe the most important part, is you are going to follow all of this up with an email to the office manager, as well as whoever else in the company you feel this needs to involve. You're getting it in writing and you say something like, hey, I just wanted to touch base based on the conversation we had earlier. You were concerned about patient messaging and I highlighted that I was totally maxed out at this point, reiterating that for patient safety, I would not be able to delay going over labs or doing patient refills. I offered to deprioritize getting charts done, at which point you said you would rather me deprioritize filling out patient forms. We will be meeting again to discuss how much time of my admin time you'd like me to allocate towards getting patient messages done. And it was suggested by you that I could, in my unpaid time, finish some of these tasks. Everything goes in writing. Everything looks a lot worse in writing. And you have to write all of it down. Your notes are signed by you. They're sealed, delivered. Your conversations with admin as they're trying to say, hey, work more, don't get paid for it. It looks a lot worse when it's all on paper and they're basically telling you do it all with zero resources and have it be their problem again to solve. This doesn't mean you hate your office manager. I know it sounds like mean and angry spirited, and I have a hard time with this because I really like my office manager, but setting those boundaries again is highly important. And this doesn't have to be in a mean way. If they're feeling threatened by you emailing back like that and having this conversation, that says more about the environment than it does anything about you, okay? You should be able to have all these conversations written and documented without feeling threatened if everything's above board, okay? So document everything. Lay out what you can reasonably do. Don't be unreasonable, okay? Don't be like, I need 7 hours of admin time every single day to get everything done. That's not reasonable. But it's also an unreasonable amount of work usually to get through all your messages, to go through your inbox. So having someone else tell you where they would like you to prioritize your tasks is literally their job, as they are managing the business and you are managing the business of keeping people safe and healthy and making sure that you are mentally well enough to keep doing this. So if you have any tips of ways you phrase things in messages to patients that you would like to share with the class, by all means, please leave your scripts down below if you have any thoughts on this. Do you do patient messaging? Like, what do you allow? What are your rules? Please do share with the class. If you are looking for general resources, as a nurse practitioner, a PA, or an NP student or something for primary care, I do have an NP binder that was recently updated that has like my notes as a primary care person and some patient handouts in there. So that's a resource that you can use. I'll probably put most of these points in there in the next update so you can reference them or copy and paste them over however you would like once I update it again. So don't go looking for it if this video was just posted. Thank you for attending class today. And remember that you, my friends, are not alone. You are more than enough and you can do hard things. Have a great day. Good luck out there. Bye.